Hello everyone. Hope you and your family are safe and well. Welcome to the latest chapter of Practo's YouTube live sessions with doctors. Today, we'll be discussing the importance of prostate health, understanding the signs and symptoms of diseases related to the prostate and the treatment. I'm Dr. Nilesh Bhandari and I head Doctor Relations and Engagement at Practo, and I will be moderating this live session. Although discussions in prostate often center around the symptoms and risk factor of prostate cancer, but with age, other issues like inflammation and enlarged prostate also start appearing. To further discuss prostate health beyond just prostate cancer and its symptoms and treatments, we have with us a distinguished speaker, Dr. Sunil Shroff. Welcome, Dr. Shroff.
Thank you.
Dr. Sunil Shroff is presently a senior consultant at Madras Medical Mission Hospital and also the visiting professor at AIIMS Resection, Uttarakhand. He also happens to be the president of Telemedicine Society of India's Tamil Nadu chapter. A reputed urologist and transplant surgeon, he is associated with multiple initiatives and is also the founder and editor of health portal medindia.net. And if you recognize him from that famous KBC episode of Karamveer, you will know that he was over there, and they won quite a handsome amount for one of his initiatives. So if you have any questions during the talk, you can send those to us in the comment section and we'll address them at the end of the session. So now we'll begin the session with Dr. Sunil Shroff. Welcome, Dr. Shroff, sir.
Thank you. Thank you, Nilesh.
Sir, I request you to start the thing with your presentation on prostate health.
So thank you again, Practo and Nilesh, for this opportunity to talk about prostate health. And let's talk about topic. Men's health today is a very important subject, and in that prostate health is extremely important because as we age, as men age, one of the problems starts with passing urine. And prostate is a gland. It's a sex gland, actually. It's an accessory gland which sits under your bladder. And it enlarges as a person gets old. And as it enlarges, it squeezes the pipe through which, the urinary pipe through which, the urine passes. And that causes obstruction. So not all glands which enlarge are cancerous. They are most, commonly benign. They're non-cancerous. And this can create a lot of problems. And sometimes, people take it for granted. Men take it for granted that as they get older, this is a likely problem to happen. And because the symptoms are, happen over a period of time, they don't get noticed so well. So I have a presentation for the next 10-15 minutes. You can stop me whenever you want me to stop. And I'll cover the common conditions related to the prostate gland. So let me just share my presentation with you.
Once again, I request all viewers to please type in the comments in the YouTube comment section and we'll take up those comments at the end.
So this gland, prostate gland, is the shape of an inverted cone. It's the size of a walnut, basically. And this little animation shows you the kidney, the ureter, the bladder, and the prostate sits right here under the bladder. It kind of, and through this, the urinary pipe goes through. This is your urine pipe. This pipe is going through this. And this is your gland, prostate gland. And, much of your ejaculate in men comes from the prostate gland secretions. So if you see this gland, this is the gland which kind of enlarges as we grow older. And this causes three conditions over the age of 50 years. A non-cancerous increase in the size of the gland called the benign prostate hyperplasia, or BPH in short, inflammation of the prostate, which is called prostatitis, and also, of course, in some men, it can also turn cancerous. Any gland for that matter in the body can turn cancerous. It could be breast is a gland, and the breast cancers happen. Same with prostate also is a gland. So that's why you can get a cancer in the gland. What is the benign enlargement of the prostate gland or benign prostatic hyperplasia, BPH? This is non-cancerous growth. There's an increase in number of cells in the prostate gland. And that's why the growth happens. And that gives rise to your symptoms. As I said, the average size of the gland is the size of a walnut or 20 grams or 20 ml. So what happens with age, till the age of 25 years, the size, till the age of, let's say, it will remain stable till the age of 25 years. But then slowly there is a spurt of growth, in the prostate gland after puberty. For 25 years, it will remain stable. That means up to 45 years, you're okay. And then there's a spurt in the size of the gland. It starts enlarging, and these prostatic cells start increasing in the numbers. So the incidence of, increase in the prostate gland, depending on the age, is very simple to remember. When you're 50, the chance of 50% men having enlarged gland. At the age of 60, about 60% men will have enlarged gland, and so on. At the age of 90, almost everyone will have enlarged gland, But enlarged gland doesn't mean that gland is causing any problem. In some men it will cause problem, and in some men it will not cause problem. So as I showed you in my earlier animation, you see this is the bladder, the urethra, and the prostate, and the pipe of the urine pipe flows through this, through the prostate gland. And this is the prostate gland, which is enclosing this. And as it enlarges, as you see this gland is enlarged here, the pipe is getting a little narrow. And then as it enlarges more, the pipe is completely got squeezed. And now what is happening is the bladder is fighting against resistance to pass urine. And that's why the urine becomes slow. And this leads to some symptoms. What it leads to, I'm sorry, the slides are slightly faded, but still you can get the message. The stream becomes narrow. The flow of your stream becomes narrow. You're not able to hit the wall anymore as you grow older. Like in a child, you can hit the wall, but when it enlarges, the stream is narrow and you're not able to hit. And then there's frequent urination at night. Then there is a feeling of not having completely voided or completely emptied your bladder. Sometimes some men will strain for passing urine. So the symptoms can be of different symptoms depending on whether the symptoms are related to the storage of urine or passing of urine. So as I said, it could be slow stream. It could be stream which dribbles a little bit. It takes time to complete. It could also lead to waking up in nights. It can lead to urgency, a little bit of burning. So what do you do when your prostate is enlarged? There are three things possible. If it's early symptoms, then we can do watchful waiting, and we can suggest for some lifestyle changes. Lifestyle changes include cutting down your fluids in the evening, like after 6 o'clock or 7 o'clock, not having water before you go to sleep or not having milk before you go to sleep. And that will cut down the fluid intake in the evening. And so the waking up in nights can get less, because one of the most troublesome symptoms of prostate enlargement is waking up frequently in the night past urine. So sometimes by just doing some simple lifestyle measures, you can help decrease the number of times a person goes to pass urine in the night. Then the second stage could be, if that is not helping, we can give tablets. This is called medical management of the prostate enlarged gland with tablets. And even if that doesn't help, then we can go for a surgical option in which we use an endoscope. There is a small telescope which you will pass through the urine pipe and then take out the gland. Very rarely we may need to do an open surgery for the prostate gland. Most of the surgeries are endoscopic. There are also, you may have heard when you talk about, tablets, in this urology is one specialty where there is, a lot of herbal treatment which goes on for, either infertility or for, impotency and stones and prostate enlargement. And for prostate enlargement, this saw palmetto is very commonly, recommended. In fact, Florida has a large plantation of saw palmetto, and they export 2,000 tons to Europe for making these capsules of saw palmetto. And there are many other plant extracts which are being advised for prostate enlargement, including zinc and tofu and so on. But these don't have evidence that they actually help. What helps is a certain drugs called alpha blockers, which we use, and we have evidence with that really helps to take away the feeling of retention, improves the urination, decreases the night time of passing urine. Surgery is indicated when the medical management has failed or when the symptoms are moderate to severe, or there is retention of urine or any complication related to that. And this, I want to just show you what surgery involves. Surgery is with an endoscope mostly. And this is called TURP, or Trans-Urethral Resection of the prostate gland. And this is a nice animation to show you what it actually is, surgery is about. So this is your kidney, bladder, ureter, this is your prostate. So we put a telescope through this very small telescope, you'll go through this, and then take away your prostate gland. So this is your enlarged gland, and this needs to be relieved. And this telescope is going through. As this telescope is progressing, you can see the picture on the right side showing you the gland. And this is your prostate gland. You can see this gland now. These two lobes of the prostate gland. And with the telescope, we go inside, and then we reach the bladder. You see how long the prostate is here? So this will be done with an endoscope. And now you'll see, now this is the gland which needs to be removed. So with the endoscope, we'll remove the gland. Let me see if there is another picture which will show you how it is being removed. Just give it a minute. And you see this now, you will see that slowly you will see some electrical loop or laser which we use to start cutting the gland. You see this? This is how it is removed. This white tissue is the prostate gland. It's being stripped out. It's just to give you a depiction of what exactly happens. Because many people wonder how we are able to remove a gland through a small pipe. But this is a very magnified view. And you see some bleeding happening, which will be coagulated and so on. So this is how, as surgeon, we do the prostate gland surgery. And this is a very common surgery which is being done. Previously, when we didn't have this about 30, 40 years ago, we needed to open every case. But with this surgery, 3-4 days, 2-3 days, sometimes even there's a day surgery, we do the surgery and patient goes home. The other condition which happens between the age of 30 and 50 years when you're very sexually active is called prostatitis. Prostatitis, when you have something called titis, which means that this means inflammation. So prostatitis is due to inflammation of the prostate gland, and that is usually due to infection. And the symptoms are very painful, and there could be pain when passing urine and pain in the lower abdomen or in the genital area in men. And as you see, this again, as you see, I don't have to tell you now, this is your prostate gland, as you know, this, sits here. So inflammation of the gland is not uncommon because sometimes the diabetic can get infection, and sometimes this infection can also travel to this testis of the patient, because this is all interconnected, these glands, So that also can happen. And the treatment for the prostatitis is medical treatment with painkillers and antibiotics. And we give some treatment to the prostate to relax the prostate a little bit with some medication. And there are two main types of prostatitis. It could be chronic, which keeps coming and going, which is a little difficult to treat. And that could be an acute one where the symptoms are very severe, very sudden, but this needs to be treated, very urgently, because sometimes this infection can spread to other parts of the body and can be life-threatening. So if you have any problem in passing urine with a lot of burning, a lot of pain, with fever and shivering, take notice, it could be prostatitis, and you may need to want to go and see your doctor as soon as you can. And then, of course, there is a cancer of the prostate. And this happens usually in men over 65 years. And the incidence will increase with age and, as you age. But what you need to remember about prostate cancer is it's not like a normal cancer. It's a slow-growing cancer mostly. Most of these cancers are very slow-growing. And you might find, a person may have prostate cancer, but in most situations, the patient does not die due to prostate cancer, because cancer is such a term, everybody gets scared, So prostate cancer can be there, but don't get too scared if that diagnosis happens. It is, if you have to get a cancer in your body as a man, prostate cancer is the safest cancer to have, according to me. Because it's only in 3% of men, this kind of cancer can be lethal. Otherwise, in most men, the prostate cancer, 97% are not necessarily lethal. It is also very common, by the way, in blacks and so on. The prostate cancer is more common. And the cancer is classified in 4 stages. Early stage is stage 1 and 2, where it has not spread, which is in the confines of the prostate gland. And then there's an advanced stage, stage 3 and 4, where the prostate, it has spread beyond the prostate. So depending on the stage of the gland cancer, the treatment is decided. Early stage, if this is the stage, then the treatment is almost 100% curable. If this is the stage, then the prognosis is a little guarded. 3 and 4. The symptoms of prostate cancer again are very not specific to prostate cancer. The same outlet, your bladder outflow obstruction, the steam can get slow and so on. There can be some bleeding sometimes. Sometimes somebody may have weight loss, general weakness, pain in the limbs or in the pelvic area with the bones. So the symptoms of prostate cancer are not kind of indicative of prostate cancer, and that's why we indicate if there's a family history of prostate cancer, or if you're worried, then you should get yourself screened for prostate cancer. And so for screening for the prostate cancer, we do what is called a rectal examination through a back passage, just to feel the gland. Whether the gland is hard or soft, and if it's hard, the suspicion of prostate cancer happens. Then we do a specific test called a screening test with a test called prostate specific antigen, which is called a tumor marker. And if that is raised, then can be a suspicion of prostate cancer, and we do CT, MRI, and then eventually prostate biopsy. So this is a slide which roughly captures everything which is required for prostate cancer testing. We look at the PSA if it is elevated. We do an ultrasound of the prostate. We sometimes do an MRI fusion biopsy of the prostate, and so on, to diagnose the prostate cancer. PSA is a good test to do, and it's a very simple test to do. So over the age of 50, it is a good screening test to do a PSA. For early stage disease, stage 1 and 2, we advise that if you're in good health, get the prostate removed. Do what is called a radical prostatectomy. Or if you're don't want surgery, then you go for what is called radiotherapy. Late stage disease, you go for hormone treatment and chemotherapy. Sorry. Now we do what is called robotic radical prostatectomy. We use a robot. Robotic prostate surgery is the commonest surgery which is a robot we use for robotic surgery. This is the commonest surgery. Among all the surgeries done in the world, the prostate surgery is number 1 as far as robot is concerned. And we use a very special system where the surgeon sits at this console and operates from a distance, and the patient is on the table, and we have robotic arms and so on. It's very precise, very well done. It is like the master is sitting here, and inside there are robots which are, they are being manipulated to remove the prostate. And it's a very safe surgery with excellent results. Advanced stage, we advise removing the testis because the growth of the prostate depends on the testis. So we suggest we remove the testis. Or we can also do what is called chemical castration by giving some medication to the patient, by giving some injections. We can do that as well. So this is my short presentation. I hope it was useful to give you an overview of prostate health, and I'm very happy to take any question and answers in English.
Yes, sir. 1 second. I'll just, thank you, sir. I think that was an excellent presentation. It covered everything that I really wanted to ask. In fact, my questions have decreased a lot because you already covered most of what I wanted to ask.
Sure.
Sir, okay, you told us prostate bare mein. So, sir, how important is it for a man's reproductive health? I mean, does it play a very, very important role in reproduction, like testes do or something like that?
Yeah, it does actually. The motility of the sperms, the prostatic fluid which is secreted out helps the motility of sperms. It gives the nutrition to the sperms. So prostate is a very important gland. I just want to tell you the story. In the past, you may have heard of harems and so on, and you have heard of eunuchs. People. Young men whose testis was removed. And when testis are removed, the prostate, doesn't enlarge. The gland gets, completely shrunk. So there's an indirect relationship between the testis, which is your, gland which produces, an organ which produces sperms, and the prostate. So by doing that, they used to make these eunuchs important, and then they used to feel them very safe in those harems.
Okay.
So that is how prostate is very interconnected with your reproductive gland.
So, sir, is the decrease in testosterone actually responsible for the enlargement of prostate? Is there a relation like that?
There is a relationship definitely with the testosterone. Testosterone plays a direct, indirect role in the size of the prostate, in the prostate health. It definitely plays a role. Yeah, and decrease, we see that, when a person is obese, you get a larger gland because the level of testosterone in an obese person is little less. So this is an indirect indication how testosterone plays a role in enlargement of the prostate gland.
Any other hormone or any other reason for the enlargement of prostate besides what we just talked about?
This is it, testosterone, and the active element of testosterone is called hydrotestosterone. So that is the active portion of testosterone which is there, and that portion, the testosterone, it gets into an active form, and that is the form which is responsible for all the things. If you give a female hormone, the estrogen and so on, again that works against the testosterone. That again can bring the size of the prostate gland down. We don't do that, obviously. That's not, we don't use that.
So a thought just crept up in my mind. Okay, as we said, almost all prostate issues arise after 45.
45, yes, 45.
Yeah. Slightly before that, the only thing you could have is prostatitis.
Yes.
In 30-35.
Younger man, yeah.
Could there be a disorder in 20-25 years old में prostate? Could there be a disorder, a dysfunction?
Yes, it is not, not uncommon at all to have in our country where infection rates are very high, to get a low-grade infection in the prostate gland. And, many men come with, this burning sensation in the urine. They're young men, 25, 30 years old, constantly complaining of some burning in the urine. And, sometimes they get odd pains in the perineum, sometimes in the, lower abdominal region, which you cannot explain, and which they are sometimes not able to pinpoint as well. And this pain can be due to the, infection in the prostate gland. So that sometimes goes very unnoticed. And this is something which is, not very, sometimes the general practitioner is not able to diagnose it also so easily. So this gets very, very, missed in the general practice, prostatitis, till they come to the urologist to see the patient, And believe me, there's a large number of population which actually suffers from prostatitis, and they don't come for help, and they don't know what to do. And sometimes this is very frustrating for them because the quality of life suffers. This is a quality of life issue. You don't die with prostatitis. You can die with, cancer prostate, but prostatitis is a quality of life issue. And the quality of life goes down because they're not comfortable. They're not happy with the daily functioning, So this is again, and they keep going to doctors, and doctors write some antibiotics for 3 or 4 days because they don't understand the problem, what's going on. And the other problem with prostate is, for medication to reach prostate, especially the antibiotics, there are very specific antibiotics which will reach the prostate gland. Not all antibiotics reach there. Okay. Because it's a deep-seated organ. It's a very vascular organ, which vascular organ means it's got a lot of blood supply. And just like breast, it's a gland. So what happens is, if there's a gland, within the gland there's an infection. Gland is nothing but, it's sac, okay, with a little, projection through which the secretions of the sac comes out. Okay, so if the gland is infected inside the sac, so what happens is for the drugs, the antibiotics to reach inside the sac is difficult. And that's why it's so difficult to treat prostatitis. So you need to come to a specialist for that. The other problem in our country is people are not aware which doctor to go to. I think that's one of the biggest challenges. Even in the medical profession, I must confess, that doctors don't know which doctor to refer to because we got so subspecialized. So what happens is many of my patients will go to a nephrologist who actually is more, is very good, but he's very good with the kidney and taking care of, if kidney failure takes place or there's inflammation in the kidney. So many of the patients land up with the nephrologist. Even the nephrologist is not aware how to treat prostatitis. So sometimes when a prostatitis patient lands up with me first, I tell him you're very lucky. You come to me straight. You didn't go to a reference. You didn't go after searching from general practitioner to somebody else, and then nephrologist, and then urologist. So most of the times we get to see the patient last. By the time he is really exhausted, frustrated, angry, doesn't know what to do. So this is what we need to also tell our audience out there, that finding the right doctor sometimes is like finding a guru, I say. Because if you find the right doctor, he'll give you the right treatment. And most of the times, if you don't find the right doctor, you're just going around in circles.
Sir, I'm sure I remember that you told us during your presentation the symptoms of prostatitis, but just for us again. So if I have some non-specific symptoms in the lower abdomen, what signs should I look for which might mean prostatitis specifically?
Well, that's what I'm saying, Nilesh. Sometimes, it's very difficult to pinpoint. But the pain is very vague. The pain doesn't have, kind of a pattern that it comes only in the night or comes in the evening or when you're sitting down or when you're driving. It doesn't have a pattern to say that this pain is coming from there. Like a pain from a stone, kidney stone is got a pattern. It'll be at the back. It'll be very severe. And when the stone travels down, the pain will radiate from your back to your groin. So stone pain is very, very classic. Whereas prostatitis, pain is not, it's very specific. It can be in your lower abdomen. It can be in the perineum. It can be in the testis, scrotum. It can be in your penis. So it can be anywhere in that area. And it just keeps coming and going, keeps coming and going. It doesn't kind of, sometimes you'll be well for a week and then it'll come back again suddenly without you knowing. So it is a very vague presentation. So that's why people, even the doctors sometimes, wonder what's going on with the patient. So that again, prostatitis are two types. There's chronic prostatitis and there's acute prostatitis. Chronic prostatitis is the one which is more difficult to treat. The acute prostatitis, the patient cannot tolerate the pain. They will land up with the doctor. And if all the doctor needs to do is a rectal examination, which is not again very common. Putting a finger in the back passage is not very common. Not every doctor does that. Only the urologist does that. But the patient has a lot of burning in the urine, fever, shivering, and pain. So that's severe. The symptoms of acute prostatitis are very severe. So patient will most likely land up with the right doctor. Whereas with chronic prostatitis, where the symptoms wane and wax and wane and wax and wane, the patient goes through multiple doctors, jumping from one doctor to another doctor to another doctor, till they find the right doctor. And some of them don't find the right doctor. I have had patients who have been suffering for 4 or 5 years before they come to me. And then when they are treated and when they get better, the gratification is huge because they've gone through so much of discomfort, so much of loss of quality of life.
Yeah, I'm sure, sir. Achha, sir, infectious causes we understand of prostatitis. Are there any non-infectious causes of prostatitis?
Yes, there are. Inflammation can be not necessarily just infection. So there can be non-infectious causes, and sometimes we don't necessarily understand the etiology, the cause of the prostatitis. There's a non-specific inflammation, we call it. Why it happens, why it gets relieved. Sometimes we give even anti-inflammatory drugs to, treat it. And the non-specific causes of prostatitis are one of the most difficult causes to treat. And sometimes you can very rarely also get tuberculosis of the prostate gland, very rarely. And that is very difficult to again catch because finding that bacteria is very difficult, the tubercle bacteria in the urine. So very, very rarely you may even get that. So, there used to be, and the prostate is a gland which has undergone all kinds of treatment. In fact, for prostatitis, way back, about 20 years back, 25 years back, there was a trial in Israel where they were using microwaves to treat the prostatitis. And they found some good results with that. By heating the gland, they're able to take away the inflammation and infection of the prostate gland. So prostatitis has gone through a lot of treatment, and we haven't really progressed as much as we should have progressed in the last 20, 25 years in the treatment of prostatitis. But having said that, I must assure your audience that most of the prostatitis is treatable. These are only 10% of the cases where you may have some problem in the long term in treating the prostate inflammation or infection.
Right, sir. So, in your experience, how common is it in Indian men? Which percentage prevalence? If you could give us an idea.
It is. Let's say that that in India we don't have much statistics. These are all people just assume and say.
Yeah.
But I think the incidence is higher than we envisage in the general population. And I think certain parts of the country, I think South has a high incidence of prostatitis, perhaps the North has. I personally feel. Well, I get many young men coming to my clinic complaining of burning in passing urine, and that doesn't go away very easily, And so one of the I personally feel that there is a good prevalence in the community. I may not be able to put my finger to it, but I wouldn't be surprised that if there is, let's say about 2 men or 1 to 2 men in 10 having some problem between the age of 30 and 50 with the urinary passage.
तो ऐसा भी होता होगा कि most of these people get treated for urinary tract infection.
Absolutely. And what happens is, this is why this herbal treatment is so popular. What happens is, the herbal treatment, when they get when they go through multiple doctors and they're given antibiotics and it doesn't get treated, then what's the next alternative? You tell me. Then they'll say, oh, why don't you go to this practitioner, Ayurvedic practitioner? He's very good. And that's why the Ayurvedic practitioners, herbal, I'm not saying they're bad, believe me. I'm not, bringing them down. But that's why, I showed you one of the slides. I brought this slide especially to show to you guys that the saw palmetto plant is used very commonly for prostate gland enlargement and for prostatitis. And 2,000 tons are exported to Europe to just make that capsules. And, in one of the statistics which I was reading, interestingly, recently was that 50% of men in Europe are actually on herbal treatment rather than taking allopathic treatment for prostate gland enlargement, because many of them have prostatitis. If they have just prostate gland enlargement, then the allopathic medicines, are much better than the traditional medicines. But for prostatitis, for some reason, some of this herbal treatment sometimes works.
Okay, right, sir. Sir, we had discussed about benign prostatic hypertrophy. That 50 at the age of 50% में होता है, 60% में होता है enlarged prostate. But you said it's possible that you might have an enlarged prostate and not have symptoms.
Yes.
ये कैसे होता है? Is it something to do with the anatomy of the particular person या कुछ और reason भी होता है?
So see, this is a very, your urinary tract is a very dynamic system. And enlargement of the prostate is a static enlargement. So in the dynamic of your body, the bladder pressure which it generates could be higher than, it will depend from person to person. Some men, when passing urine, may be generating slightly higher pressure. So, it is all on your muscle, how well your muscles are developed. So bladder also is a muscle. So if the bladder contracts well, so even if there is a slight enlargement of the prostate gland, the urine will still come very well. But let's say if the bladder muscle is not well developed, even the smallest enlargement of the prostate can give rise to more symptoms. Right. So the body's dynamics are very different. I've seen, normal gland is 20 grams. I've seen people with more than 200 grams prostate who don't have any urinary symptoms. And I've seen also patients with only 15-20 grams prostate having very severe symptoms. So as I said, the size of the gland or the enlargement of the gland has no correlation to the symptoms of the patient.
Sir, मैं फिर ये सोच रहा था कि now once the gland enlarges, symptoms start coming.
Yes.
May or may not, but let's say it does.
Generally speaking. Yes.
So when do you decide that let's start a treatment? Till the patient complains too much, is there some kind of criteria? Okay, now let's start treatment.
So again, this urine problem is a quality of life issue. The quality of life issue, there are men who will be, when they go to public toilet, they are a bit hesitant to pass urine in public toilet, in the open with other men, standing side by side, because they take longer to complete. They take longer to start the urination, So they feel a bit, shy to share, the same space. So they will go and close themselves in the commode room and pass urine, but then they can take as much time as they want to. So if a patient, we have a very nice, interesting, we give it an interesting name called executive prostate. Many executives who are under high stress, who are very under a lot of anxiety, they have more hesitancy than a normal person. Many of them, because again, on anxiety also there is the dynamics of the prostate changes. So we call an executive prostate a man who has a lot of hesitancy in passing urine, and there are men like that out there in the community. Some of the men in the audience may know that. They may be experiencing it themselves. That normally when you're standing in front of the toilet, in the few seconds, 1, 2, 3 seconds to start passing urine. But if you're waiting for more than 10 seconds, 20 seconds, 25 seconds to start urination, that is called hesitancy. Okay, so we look at all the symptoms one by one. How much of hesitancy the patient has. Yeah, if the patient is taking very long to start urination, if the stream has come down, the stream flow has come down, we look at that. Then we look at how much of urgency the patient has in passing urine. Some patients will say, when I want to pass urine, I have to run to pass urine. So we look at that. Then we look at how much of how long they take to finish the urination, which is called post-void dribbling. So we look at that. So we look at, and then we see how many times the patient is waking up in nights to pass urine. So let's say, waking up once in the night is not uncommon. But once you start waking up more than once in the night, the quality of life is, quality of sleep is disturbed.
Yeah.
Once the quality of sleep is disturbed, then you're tired in the daytime. So if somebody is waking up 3, 4, 5 times in the night, so we take all the symptoms together, decide which patient requires what treatment. So if there's somebody who's waking up twice in the night, has a bit of slow stream, is not too bothered, by the we have a score for that, we call it a bothersome score. So we look at that. And if they're not too bothered, then we give them lifestyle advice, cut down your fluids, if somebody is on diuretic, many of them heart patients are on diuretics. And if they're taking diuretics in the evening, they'll be waking up at night many times to pass urine. So we'll ask them to change the timing of the tablet. Many patients on blood pressure, because these days in the community you'll see diabetes, hypertension, and prostate to be very common. Invariably, every patient who walks into my clinic has these 3 things these days. So we look at diabetes. If the diabetes is not well controlled, the frequency of urination will change. So, frequency of urination will increase. So we'll ask the patient, get your diabetes under control. If they're on antihypertensive blood pressure tablet, they may find some swelling in the legs. When they lie down, the swelling will be less, which means that the body fluid comes back to the heart and they make more urine in the night. So they wake up more in the night. So we tweak the blood pressure tablet. So we give them this lifestyle changes to do, and some of the patients will improve from passing 2 or 3 times in the night to just once in the night. So their quality of sleep is not disturbed, and that some patients are happy with that. But some patients, despite that, doing all these things are not, don't get relief from the symptoms. Then we give a tablet. There are 2 types of tablets we give. One is to relax that area of that, you saw the squeezing of the pipe, to relax that a little bit. So this is called alpha blocker. We give alpha blocker. And then we have another tablet which decreases the size of the gland. We reduce the size of the gland. As you age, the size of the gland increases. So we try and reduce the size of the gland by giving you the tablet. And this is, another type of tablet which you give. So we actually try and make the prostate younger for those patients, by decreasing the size of the gland. So by decreasing the size of the gland, the static component of the prostate is, we try and, overcome that, which is causing the compression on the urethra. So these are 2 types of tablets which we use. And believe me, we have done huge number of trials on huge number of patients. And over the last 30 years, the management of the prostate gland enlargement has totally changed. Previously, it used to be just surgery. Anybody comes, we do an endoscopic surgery and remove it. But in the last 25, 30 years, we have had a good change, and the medical management of prostate has reduced the surgery of the prostate, endoscopic surgery, by 80%. Because the tablets are so good at managing the enlargement of the prostate gland. So from surgical management of the enlarged gland, we've gone to a medical management of the enlarged gland. And we are learning more and more things about these molecules. And these tablets are now getting, they're so, the precision is so good that, sometimes these tablets can also lower your blood pressure. The same tablet.
Right.
So, but the tablets now coming are so precise that they will not lower your blood pressure so much, but they will only make sure that the prostate, the area is relaxed, So we have improved the medication as well. So that's why when we give these tablets also, if anybody out there is taking these tablets called alpha blockers, when they get up in night to pass urine, I always tell them, sit by your bedside for half a minute and then get up. Because sometimes when they get up from lying down position, they get a decrease in their blood pressure. It's called postural hypotension. They can fall and they can hurt themselves. So we give them advice that if you are on these tablets, just take precaution. That you don't feel giddy. You don't fall in your bathroom when you're walking to your bathroom. So sit on the bedside, let your blood pressure stabilize before you go and pass urine. We tell them that. We tell them to put a handle in their toilet. We tell them to put a small night lamp in the room so that they can see in the dark, they don't fall. So these are the precautions to take with these tablets,
Sir, ये तो अच्छा news है कि from being completely a surgical disorder which need to be treated by a surgery, now most of these patients can be treated purely by medicines, and a very small proportion needs surgery.
Absolutely, absolutely. So this is a great advancement, and and these drugs have gone through so much of trials, over the years now. We exactly know how it will behave on the patient, looking at their flow. So many of these patients, what we do is when they come to our clinic, we assess them. We told, no, how do you assess them for who to treat and all that? There's an investigation called Euroflow. Euroflow tests the velocity of the urine, how fast the urine is coming. It's an objective assessment of the urination. So we assess by Euroflow what is the flow rate. And then we decide that this patient can do medical management, this patient requires surgical management by looking at that as well, at that reading, So that gives us, so we do a couple of Euroflows, and then we ask the patient, is this your normal flow? And if the patient says yes, then we decide on how to treat the patient. So the science of, the whole science of, prostate health has improved tremendously today. And that's why I tell all your audience which is out there, if you're over 50, and if you are having problem in passing urine, don't take it for granted that this is your aging process. Go to your doctor, go to a urologist, look for a urologist nearest to you in your area, very easy to find. And not neurologist, urologist, UROLOGIST. Because most of them, when I say I'm a urologist, they ask me, oh, you mean neurologist? I said, no, urologists. Urologists are generally plumbers of the body. They take care of your plumbing system.
Right. सर अब मैं तो इंडियन हूँ, हम सब इंडियंस हैं, तो एक क्वेश्चन तो पूछना बनता ही है, व्हाट शुड आई ईट इफ आई हैव हाइपोट्रोफी? खाने से कुछ होता है? क्या खाना चाहिए, क्या नहीं खाना चाहिए?
If ऐसा है, I'm not an expert at it. But I can tell you only thing is eat healthy food. Do exercise. That is very important. There is very little out there with evidence. I showed you a list, if you remember, of a lot of stuff which are being recommended. Zinc, you say that people say that if you have more zinc, your prostate will be good health. Zinc has a role on prostate health. There's no questions about it. So there are some people talk about some seeds which help the prostate, and so on. So if you just Google out there, there are a huge number of list of food items which are advised. But just believe me, simple measures work the best. And the problem with this food is, it varies from, which batch you are eating. Sometimes you get a batch of food which may have some better quality of stuff which will help you, and some will not have that. So ऐसा कुछ नहीं है कि क्या खाऊं क्या नहीं खाऊं, but I can always say that you have tomatoes has lycopene, and that has some protection, to your prostate. It's good for your prostate cancer also. Have tamarind, have haldi. These are all Indian food items. These all have good for your health.
I specifically asked because I heard about tomatoes. इसलिए मैंने पूछा था ये question.
Tomatoes have lycopene, and lycopene is, very protective to the prostate. We don't have, very hard evidence on these things, But there is some evidence that it may do good, especially in patients to prevent prostate cancer, perhaps. But if you have to eat too much of tomatoes, that has oxalates also, that can lead to also small kidney stones.
Okay.
So you have to be careful how you balance it.
Yeah. Well, excess कुछ नहीं करना है. ठीक है, tomatoes help you out, zinc might help you out.
Yes.
Don't exactly. Somebody just asked me one particular term. I think you already answered it, in a different way. But he asked for this particular term. What is watchful waiting?
Yes, that's what I said. Lifestyle changes. I said in fact, the first thing I said was that watchful waiting is don't give them active treatment with medication. Just change the lifestyle of the patient and look at other comorbid factors like diabetes, blood pressure. Many times, a cardiologist will refer to me a patient saying that this patient is passing urine 3 or 4 times in the night. Can you please look at him and give me help the patient? When I look at the patient as a whole, I see that the patient may be taking a diuretic in the evening, and that's why diuretic is something by which you pass urine. So then I tell the patient that, look, you're passing urine because your diuretic needs to be changed. There may be an antihypertensive which is causing a lot of water retention. When they cause water retention, when a patient lies down, the water returns back to the heart, and then you start making urine. So there can be a cardiac cause to the urination, not necessarily a urological cause to the urination. A physiological cause to the urination rather than a disease cause to the urination, a pathology for the urination. You understand what I'm saying?
Yes, sir.
So watchful waiting is about understanding the whole spectrum and understanding exactly where the patient is coming from, and if the patient's flow is good and patient has some specific symptoms like waking up at night, which is what most of the patients will come with when they are distressed because they're waking up more than 3 times in the night or 2 times in the night and they're not able to get decent sleep. So they will come and see you. So in that situation, cutting down the fluids in the evening, giving all this advice, general advice, helps them to decrease the number of passing urine. So watchful waiting is about just tweaking those lifestyle changes and not giving them medication. Because once you start medication, you can't stop this medication. They are for lifelong.
Alright. Sir, अब मैं ये पूछ रहा था कि okay, अगर now I'm just shifting to the next topic. So prostate cancer से पहले benign hypertrophy होना जरूरी है या it can be ऐसा कुछ नहीं?
Not necessarily. Not necessarily.
And there's a chance कि benign hypertrophy के अंदर भी कोई cancer foci आ जाए.
Possible.
That is possible.
Because as you age, the prostate gland will enlarge. When the cancer will hit you, you don't know. It can hit you at 60, it can hit you at 65, it can hit you at 70. So उसी के अंदर जो benign prostate जो है, उसके अंदर एक gland will get cancerous. It can happen. Everything is possible.
So what makes some men more likely to have cancer than others? कुछ है causes?
Yeah, so there are some risk factors to prostate cancer, and the family history is one of the important risk factors. There's also some genes we have identified which are more prone to prostate cancer. So there are some risk factors which are there, which we need to be aware of. But I think that of all the risk factors, the family history is the one which which you should watch out for. The blacks have a high incidence of prostate cancer. Asians are supposed to have a lesser incidence of prostate cancer. The Japanese have a lower incidence of prostate cancer. We Indians probably, again, it varies from region to region. I think the North Indian men have a higher incidence of prostate cancer than South Indian men. In fact, I did a study to look at there's some gene called androgen receptor gene. Androgen is your testosterone, estrogen, and all that. So there's an androgen receptor gene, which and there is a change in the gene format, which makes them more prone to prostate cancer. So it varies. It varies from a population segment to population segment. But family history is a very important thing to look for.
एक particular question है alcohol intake का कुछ है cause prostate cancer के साथ?
Smoking and alcohol is always a risk factor.
Okay.
And alcohol is more of a risk factor also for erectile dysfunction.
Right.
More than anything else,
Yeah.
Prostate cancer से ऐसा कोई direct नहीं है. If you start looking at literature, you'll find some odd paper somewhere which may implicate it, but we don't have. In fact, there was one paper which showed that people who have had vasectomy have a high incidence of prostate cancer. But that again was very small number. We couldn't be very sure about that.
तो larger studies पे causes क्या निकले हैं सर? कुछ निकला है concrete evidence based?
Cancer as such, we have very few cancers where smoking is a risk factor for all cancers.
Right.
So like that we have not necessarily too many risk factors as such earmarked. This is again a silent disease. Prostate cancer is a silent disease. So age is a risk factor. As you age, the chance of prostate cancer is higher, as I showed you in my slide.
Right.
Race is a risk factor. Certain races are more prone to prostate cancer. Smoking, you said, is a risk factor. And I also said to you that blacks and have a high incidence of prostate cancer. And a family history, as I said to you. So these are 4 or 5 things which one needs to keep in mind. And today environmental pollution also is there more. And whether that's a risk factor or not, nobody can say, but it is an indirect risk factor for any cancer for that matter.
Sir, prostate cancer, like you told us, generally it's not fatal because it's a very slow growing cancer. But can it spread to other parts of the body?
Yes, it can. So there are two types. See, then we say something called a natural history of cancers. In the natural history of cancers, the majority of the prostate cancers have a indolent course, means they're slow growing, But there is a small number of prostate cancers, small percentage, which are like any other cancer, which can be very fast growing. So we should never take it too lightly. We should know the natural history, and depending on the natural history and follow up the patient, looking at the various parameters, we decide on the mode of treatment. So if the cancer is very fast growing, definitely it needs treatment. So we cannot ignore it. So we have staged this prostate cancer by a grade called Gleason's grade. And this is, we do a biopsy of the prostate gland, and we look at what is the grade of the cancer. If the grade of the cancer is high, we call it, grade 7 or higher. Grade 7 or higher should be treated by some kind of modality. 7 and lower, some of the 7 also can be lower, but 6 and 5 and all that, these kind of cancers can be washed. But if you have a cancer with Gleason 7 to higher, 8, 9, then these cancers need to be treated. And that can be only told by doing a biopsy of the prostate gland. So we have a method by we do a biopsy of the prostate gland. We take small cores from the prostate gland. We look at the Gleason's score, and then decide on the line of treatment for the treatment for the prostate cancer. The thing is, the audience out there needs to be aware of this. That there is a possibility, and if your PSA is raised, the normal PSA is 0 to 4. And if you are going for a screening, let's say Master Health Checkup. Master Health Checkup doesn't have prostate specific antigen, the PSA. It doesn't have, unfortunately, in India. But you can ask separately for PSA. And if the PSA is raised between over 4, then you should go and see a urologist. And that urologist will then take a call whether you have a cancer, what needs to be done about it. So from 4 to 10 or 4 to 20, the PSA is a very treatable stage of prostate cancer, where you can remove the prostate gland completely by doing a robotic or whatever, open radical prostatectomy, and the gland is fully removed, and you can more or less you're cured of the disease, or one can go for radiotherapy. So it is very important to be aware that there is a way of screening for prostate cancer, and men over the age of 50 should be aware of this. And when they go to the doctor, they should say to the doctor, "Doctor, please make sure my prostate is okay. Please make sure that I don't have benign prostate hyperplasia." It could be, as I said, the BPH is silent growing, or it could be cancer. So a simple screening method by doing an examination of the patient, doing a rectal examination, followed by a ultrasound to look at the gland, followed by a uroflow, and then looking at how much of urine is retained in the bladder, called post-void ultrasound, and a PSA. These 3 investigations are enough to be able to talk about prostate health. Clinical examination of the prostate, a uroflow, and a PSA. So these 4 things should be done for prostate, looking at prostate enlargement. And these 4 things will tell you whether it's a benign enlargement or whether it's a cancerous enlargement.
So, sir, what I gather is that after the age of 50, we should do an annual PSA examination.
Yes.
And agar 4 ke upar aaya, meet a urologist straight away.
You meet a urologist straight away. Absolutely. And the new specialty is men's health. And in men's health, prostate is a big brother.
Definitely, I'm very sure.
Big thing, And prostate should be kept, if you keep your prostate healthy, you'd have, less problem with urination, you'd have a good sex life, everything will work well.
A question, sir. I know you have already answered this, but because somebody specifically asked this question again, मैं फिर से आपको बोल रहा हूँ कि partial or complete partial removal in benign hypertrophy and complete removal in cancer. उसके बाद sexual health पे कितना फर्क पड़ता है, क्या फर्क पड़ता है?
So by removing the, when you do a prostate surgery, benign-ly, when you do the surgery, when you do the TURP, by removing the gland, which is partial removing, men don't get impotent. Potency is correct. Okay. Some men, may get some problem with their potency, because as a man ages, the potency comes down in any case. So some men will experience a loss of potency, meaning that the erections may be a problem. But what they must remember is, the ejaculation will be dry in men. But what happens is the prostate, when it's taken out, the ejaculate, which comes out normally from the penis, will go back into the bladder. And when the man is passing urine, the sperms will come out in that. So it's called, dry ejaculation.
Okay.
So that happens, and that can be very distressing in men. So whenever I am actually doing this prostate surgery, especially in the age group of 50 and 60, I ask them that, have you completed your family? Do you want to have more children? Sometimes, today men are getting married at an older age. And believe me, many men will say, no, doctor, I want to have children. This is very important for, again, the audience out there to know that if you are in the age of, let's say, if you want to have children, and whatever age you are, then if you have prostate surgery, you may not be able to have children. As far as, complete removal of prostate, that is called radical prostatectomy. We do what is called nerve-sparing radical prostatectomy. When you do a nerve-sparing radical prostatectomy, then again we try and keep the potency in men intact.
So what I understand, sir, is okay, there would be an orgasm, but you'll have a dry ejaculate, and you can't father children.
You can't have children.
So sexual health as such, पे इतना फर्क नहीं पड़ता है, but हाँ, the ability to have children will go.
Yes, that's absolutely. Infertility हो जाता है.
Infertility हो जाता है.
Yes.
Okay, sir. I think we've gone through all the questions, but एक मेरा last question है. फिर मैं आपको जाने दूंगा. But I know you have to prepare for the conference from tomorrow. Telemedicon is happening tomorrow, and I'm sure you will be speaking over there in lots of panels. So you have to prepare. One last question, sir. I'm 25 years, 30 years, healthy prostate, कोई issue नहीं है. Are there some things I can do to ensure कि मुझे बाद में भी कोई issue ना आए? Can I do something in my youth?
I think, healthy lifestyle always works. Really, this is my personal feeling that, keep your weight optimum. Eat healthy food, get good sleep, be off stress. One of the things which actually affects your sexual life and your prostate is stress. Stress is a big killer. Anxiety is a big killer. And if we can take care, as men, what happens is we suffer in silence. We don't talk about our fears. We don't talk about our anxieties, and that kind of adds up. And that creates a lot of problems. And that affects your prostate as well. So I would put anxiety and stress on top of the list, besides whatever else you do, eating a healthy lifestyle and so on. So if you are able to do de-stress, I think yoga is a good thing to do, especially if you are, executive, have a high stress job, practice yoga. Believe me, it de-stresses you. Do meditation, it de-stresses you. That will help. Because that'll help your sexual health as well. Anxiety kills your sexual health as well. It also kills your prostate.
Right, sir. Thank you, Dr. Shroff. Thanks a lot for shedding light on this very important topic of prostate health, which generally stays hidden because people don't really talk about that. So today, I think we covered all whatever prostate health we could today in this 1 hour we had. So I would thank you again. I would like to extend my gratitude to you and to all the viewers on the very important topic. On behalf of the entire team at Practo, I thank you all for joining us today. Thank you, sir.
Thank you so much. All the best.
Thank you, sir.
Stay safe.